Hi, everybody. It is 4 o'clock on Tuesday. That time we come together for Virginia Moore to remind us that we're going to get through this and we're going to get through this together. I want to thank Bryan Station High School, Fayette County Public Schools, for their mask today. To all of our educators that are working as hard as ever virtually right now, thank you so much for the experience that you are providing. And while I know there are many of us, myself included, that would prefer that our kids be in-person learning right now, we know that you are working as hard as you can to provide the very best experience. And we do believe right now that the steps that we have taken are absolutely necessary. And maybe today's report will convince those out there who disagree. No way to sugarcoat it. Today is the very worst day that we have had for reporting on the spread of the coronavirus, and it is the deadliest day that we have had. Today, we're reporting 4,151 new cases of the coronavirus. This is exponential growth. Remember how we talked about it taking 7 odd months to have our first day of 1,000 cases, about a month and a half to have our first day of 2,000 cases, about a week or so to have our first day of 3,000 cases. And guess what? Here we are at 4,151 cases. That's the highest number we have ever had. And today, it includes 461 kids. It's 461 of our Kentucky kids, most of them school age, who are infectious with this virus right now. We are thinking about them. We hope that most of them are asymptomatic. We are fortunate that we've identified who is positive on all 4,151 so that hopefully they are taking the steps not to spread this virus any further. We're now up to 183,168 cases since March the 6th. So today is a record number of cases, 4,151. Record number of kids under 18 testing positive, 461. Record number of people currently hospitalized for COVID-19 in Kentucky, 1,777, up 36 from yesterday. Today we have a record number of people in the ICU because of COVID-19 at 441, up 20 from yesterday. And today we have a record number of people on a ventilator fighting for their lives because of COVID-19 at 241. That is up 12 from yesterday. And today we have a record, at least from May 5th, when we were able to start ramping up testing, of our positivity rate now at 9.59%. Put simply, today is a terrible day that shows us how quickly this thing is spreading and shows why it is so important to take steps to stop it before it gets any worse. New cases by county. Jefferson County with 700 cases. Our heart goes out to the residents of Jefferson County. Until recently, I was a resident of Jefferson County. We are thinking about you, and we're going to be there for you. Fayette County, 238. McCracken County, 172 cases in McCracken County. Warren County, 148 cases. Kenton, 126 cases. Hardin, 120 cases. Davis, 119 cases. Boone, 102 cases. Madison, 97. Laurel, 89. Oldham, 80. Campbell, 73. Christian, 72. Hopkins, 67. Marion, 62. Bullitt, 61. Lincoln, 56. Nelson, 55. Hart, 54. Pike, 51. Montgomery, 50. Carter County, 49. Clay County, 49. 48 in Barron and Graves. 44 in Pulaski. 41 in Greenup. 39 in Magoffin. 38 in Marshall. And the list goes on and on and on, with numbers that I haven't read yet. You go down 7, 8 counties. Franklin County with 28. Harlan County with 25. It's all on kycovid19.ky.gov. But it means that there is a huge amount of virus spreading rapidly in every county across the Commonwealth, which means it takes all of us doing our part in a concerted effort if we are going to slow this spread and save lives. If we don't work in a concerted effort, if we don't all do our part, if we try to be the exception, then slowing down this thing won't work, and we will lose a lot more Kentuckians who we love and care about. If you need more convincing, today, the deadliest day with 35 new deaths. For people in their 50s, 60s, 70s, 80s, and 90s. And it's a long list. 70-year-old man from Boyd County, 75-year-old man from Callaway County, 82-year-old man from Christian County, 96-year-old woman from Davis County, 95-year-old woman from Graves County, 66-year-old man from Grayson County, 79-year-old woman from Grayson County, 57-year-old man from Grayson County, 86-year-old woman from Grayson County, 93-year-old woman from Henderson, 87-year-old man from Hopkins, and a whole lot from Jefferson, including a 77-year-old woman, 76-year-old woman, 72-year-old man, 61-year-old woman, 80-year-old woman, 64-year-old woman, and a 64-year-old man, 73-year-old man, 94-year-old man, 64-year-old man, 77-year-old woman, 66-year-old man, 62-year-old man, 60, all of those just from Jefferson County. 62-year-old woman from Jessamine, 76-year-old man from Kenton, 79-year-old woman from Marshall, 66-year-old woman from Mason, 64-year-old man from McCracken, and a 59-year-old man from McCracken. 88-year-old woman from Monroe, 64-year-old man from Monroe, 65-year-old man from Montgomery, 93-year-old woman from Robertson, and an 82-year-old man from Union County. So these individuals are real people that are loved by the people around them. Today's memorial came to me from someone I know who had reached out in his grief. So yesterday, a friend of mine lost his father to COVID-19. At 1:46 a.m. on November 30th, Bruce Gdansky, 76, passed away after a long-fought battle with the virus. Bruce and his wife, Mickey, became infected with COVID-19 at the end of October. While they were able to handle treatment at home for the first few days, Bruce was transferred to Baptist Hospital on November 6th, and his wife was admitted only a few days later. Although she was able to fully recover, Bruce continued to get sicker and sicker. On the 14th of November, Bruce left his son, Chris, a voicemail, the last voicemail Chris would ever receive from his father. 4 days later, Bruce was intubated. On the 27th of November, the team at Baptist medically paralyzed him to help his body rest from the struggle. And then yesterday, as Bruce passed on, his wife and son were left to say their goodbyes, urge him on to a better tomorrow through a phone held to his ear by a nurse. That is what COVID does to our loved ones. That is how it impacts our ability and the way we say goodbye. Bruce was a friend to everyone and a stranger to no one. He was a man of service. He was a U.S. Navy veteran serving in Vietnam, and also as deputy sheriff in Oldham County for 10 years. Bruce championed causes for the elderly during his time as vice president of operations for the Louisville Better Business Bureau, working with the FBI against consumer fraud. And he also spent time volunteering for the St. Matthews Baseball League, where he made friends young and old, something his son Chris would miss seeing the most. Above everything else, Bruce was a loving husband to Mickey, a father to 2 sons, and a grandfather to 5 children. He was a passionate fan of baseball, bourbon, cigars, and a good joke. What we must stress here is that Bruce and Mickey tried to do it all right, They barely left the house in 9 months and they always wore a mask. But that's the thing about masks. It takes all of us wearing them correctly to protect one another. If we do, we can prevent the loss of individuals like Bruce and the heartbreak his family is now mourning. So to Chris, to Mickey, to your whole family, we are so sorry for your loss. We thank you for letting us share a little bit of Bruce with the rest of the world. And this shouldn't have happened. Shouldn't have happened even amidst this pandemic. It's not fair that it happened to y'all. We're going to do our very best for you moving forward. I'm wearing my mask for Bruce and for all of you. We will do everything we can to make sure that this doesn't happen to any other family. So to everybody out there, Bruce should still be with us. He should still be with Mickey. He should still be with Chris. He should still be with his other son and his grandchildren. We all have a duty to protect one another, to protect individuals like Bruce. And we at least failed him. So can we do better? Let's please try. We continue to see our long-term care facilities, again, overwhelmed by the community spread of this virus. And when we talk about where we are right now, the virus is spreading so much, it overwhelms any communal setting, anyone. It's overwhelmed our long-term care facilities. It's overwhelmed our prisons when it gets in. Any place where people gather, if we have our current community spread, it will spread and it will ultimately harm people. 173 new residents, 109 new staff testing positive, 18 new deaths attributable to long-term care residents. So get this, right now we have 57 long-term care facilities with 15 or more active cases. These are facilities that test their workers, many of them 3 times a week, that wear PPE religiously. They're not letting down their residents. Our community response isn't where it needs to be. We need to know whether or not people in long-term care facilities get COVID is about what we do in our daily lives, the decisions we make, and whether or not we do what it takes to prevent it from spreading to those around us. And because of that community spread, we've lost another veteran at the Thompson Hood Veterans Center in Wilmore. We previously thought that he was recovered and was going to recover, but has since died. That's 31. 31 veterans who served our country, who we were able to protect until the middle of October with no cases there. Because of community spread, 31 individuals who fought for us that we have lost. We still have 2 active cases of COVID in the Thompson Hood Veterans Center. It's been 18 days since the last COVID positive result in a veterans center there. We hope that we are stemming the tide. But as long as there is this active of community spread, there is still significant possibility of losing more veterans, losing more people in long-term care facilities, losing more of everyone. So the veteran who first became active, the first active case of COVID at Western Kentucky Veterans Center in Hanson, has also now died. We've also had a COVID-19 related inmate death. He was incarcerated at the Lee Adjustment Center. It's a 37-year-old man, initially taken to the local hospital and then transferred to Norton's in downtown Louisville. He passed away yesterday, November 30th. He did have underlying health conditions. So that's where we are. COVID is spreading like wildfire, taking record numbers of people from us, infecting record numbers of people out there. That's why we're fighting back. That's why we're trying to be aggressive and not wait for it to overwhelm us, but to try to stem this third wave just like we stopped the first 2, to not surrender and accept unacceptable fatalities, but to fight back for those we care about. Part of that is testing. With it spreading the way it is right now, we need to continue to get people tested regularly. I want to walk through some of those options. Right now, we have more testing locations than ever before, so there's no excuse not to get out there and to regularly get tested. Over 300 58 locations across this Commonwealth. Let's go through a few. With Louisville having the number of cases they did today, let's start there. First, we have the surge testing that the federal government has been helping us with. That's what we would call the fairgrounds. That surge testing is also being done in Lexington. You sign up for an appointment. It's free. It's actually moving really fast, and we have increased the number of tests that we are doing. It's a partnership, again, with the federal government, who's paying for all those tests, paying for most of the testing. We're providing some of the logistics, so we are grateful for that extra help. Next is the Norton's location. We continue to provide testing to Norton, and they, again, accept reservations the way that is listed on the screen. So you can sign up to get a test there. Finally, U of L. We have multiple testing locations in a contract with the University of Louisville. You can sign up there as well. So many different locations in that area. In the Lexington area, the second most number of positive cases today. In addition to that surge site, UK has a partnership with the state where there are multiple locations, again, where you can get a test in Lexington. We'll wait for that to come up so people can see it. That's with UK, and I believe they're using a company called Wild Health that is doing the testing. Regardless, that's on kycovid19.ky.gov. Then Northern Kentucky, where we are seeing significant number of cases, especially in Kenton, Campbell, and Boone County. St. Elizabeth's is our partner there. Again, these tests are free. You can sign up, and you should sign up. Make sure you get tested. And then we have 4 different locations that we are working with throughout the state. Those cover just about every other area of the state. But I've only listed, about 10, 11 different locations out of the 300 plus. So we need you to continue to get tested. And that's not for the numbers we read, but it's for your safety, to make sure if you are positive, you get the help that you may need. And it's also to prevent the spread to other people. Think about it. If we don't find out that the 4,000 people today plus are positive with COVID, and each of them doesn't know, and as we've said, can spread this virus to hundreds of other people, how quickly that can grow. It also underscores the importance of continued federal support, in the very least, for testing, for contact tracing, and the other necessary steps, public health steps, to defeat this virus. We're going to have a couple of other updates, and then we're going to get an update on contact tracing. I want to start with CARES Act funding to local governments. Our local governments have been lifelines in our communities during this pandemic. That's why we set aside $300 million in CARES Act funding to reimburse city and county governments for expenses related to COVID-19. We did that back in May. $250 million of the allotment was divided based on population from recent census data for immediate release. And the other $50 million was reserved for future hotspots and other needs. After discussions with the Kentucky Association of Counties and the League of Cities, we're now releasing that last $50 million. Approximately 200 cities and counties are eligible because they've already exhausted their original allotment and have remaining eligible reimbursements. To apply, eligible local governments will follow the Department for Local Government's original application process, which is outlined on their website. Thank you to all our local governments and leaders that are fighting this thing every single day, that are part of Team Kentucky, that are trying to do it right. You have been an important piece of how we fought back against this virus. And again, once this allotment has gotten out there, federal government will need to step up to provide additional help moving into the future. Everything stops at the end of December unless we get a new act from Congress. Okay, other ways that we're working to help people: the Healthy at Home Utility Relief Fund. So we created several funds to assist Kentuckians through this difficult time, including the Food and Beverage Relief Fund, which we're going to talk about in a minute, the Eviction Relief Fund, where we've already provided $15 million of help, and $15 million for the Healthy at Home Utility Relief Fund. The CARES money we've directed to these funds must be spent by the end of the year, and we want to make sure they help as many people as possible. So there is around $11 million remaining in the Healthy at Home Utility Relief Fund, and I want to encourage those who are eligible to apply. That will help you so you're not behind on your bills. That will also help your utility, which many right now need this extra assistance. Eligible households can receive a one-time $500 benefit towards their water and or wastewater and $400 towards their natural gas or electricity bills. Crisis assistance is still available for households with past due natural gas, electric, water, or wastewater bills. This is to help resolve an arrearage and prevent a pending disconnect. Funding for electric and natural gas benefits has been increased to assist more households across the state. The Healthy at Home Utility Relief Fund now has subsidy program available to assist more Kentuckians and is intended to prevent a future crisis and possible disconnection. This is for households with incomes up to 200% of the federal poverty level who have been economically impacted due to COVID-19. Apply at your local community action agency. To locate that office, call 1-800-456-3452 or visit www.capky.org. All right, last update on one of our funds that's out there. This one is to assist restaurants and bars that are being significantly impacted by this pandemic. As of 3 o'clock today, we received 2,650 applications with a total requested amount to $25.6 million. We are working through these applications. We've already approved $1.7 million to go out. And that's just because that's how far we've gotten in the last day or so. We will be fast on approving these dollars. So a couple questions that we've gotten. Do we have any numbers on how much the restaurant fund is being used, numbers of requests, anything like that? So again, in the first 26 or so hours of the fund, 2,650 applications filed. And we're going to continue to take applications until we have fully exhausted the $40 million that we have set aside. What can business owners who receive the funds use them for? Are there specifications, for example, to allocate money to employees? Eligible expenses are expenses incurred by the business entity from March 6th to December 31st this year for the following items: mortgage rent, salaries and wages for employees or contractors, employer contribution for both employee health insurance costs, business supplies or equipment, inventory, utility payments for the business location, PPE, or measures implemented to protect employees or customers from COVID-19 and to comply with the Commonwealth's Healthy at Work requirements. Finally, the Public Protection Cabinet has begun reviewing applications as of yesterday. What does the review entail? So it's a multi-step system that starts with the online portal. Restaurant and bar owners should visit teamkyfbrf.ky.gov and carefully review the eligibility criteria before applying. After completing the process, a team of reviewers will ensure all documents are included and the claim meets eligibility requirements. An applicant will be notified of their status through email. If there's something missing or in question on the application, the team member is going to follow up with them and attempt to correct any errors. So please get those applications in. I know that 10,000 isn't anywhere close to making you whole, but let's at least get these dollars out to help in the way that they can. Final update is on vaccines. Kentuckians can visit kycovid19.ky.gov to view the latest information we have on the vaccine. That includes the draft of our vaccine plan, outline on planning phases, critical populations, and vaccine provider enrollment and administration. There's also CDC COVID-19 vaccine resources and frequently asked questions. We're going to update this regularly. So we're getting a lot of questions, which is good, on vaccines. A lot of them can be answered with the resources on kycovid19.ky.gov. I will warn you that the information we get on the vaccine changes frequently. Now we're ready to roll with that and to make sure that whatever allocations we get, We are getting out there as quick as possible to those most in need. But do understand that if the information we get from the federal government changes, the information that we give to you changes. We're going to be transparent about that information each and every day. All right, we have an update from Mark Carter now on contact tracing. Mark?
Well, thank you, Governor. Let me just start out with a brief overview of contact tracing and what it is and what it isn't. I know that I've described this before, and I think with the attention to contact tracing in the popular press, most people think they know what it is. But let me just spend a minute on that topic. And probably the best way to do that is just walk through a case. So essentially what happens is someone tests positive for COVID. A lab notifies a local health department. It goes through a process to get there, but that's what happens. Once that occurs, a disease investigator, which is typically an RN or a clinician, will call the person who tested positive and interview them. And that call is focused primarily on that individual, his or her health, what they need to do to protect themselves. It's important. It's an important part of the process in terms of trying to determine where the person became infected, to learn more about the infection that can inform of future clinical interventions as well as public health interventions. A component of that disease investigation is compiling a list of potential close contacts. That becomes the second part of this process, where those are handed off to a contact tracer, who will then call those individuals and essentially walk them through what they need to do to protect themselves, their family, loved ones, fellow citizens. So it's important. It's a two-part process that consists of a disease investigation and the actual contact tracing. And the focus and the goal from the start has been on containing the spread of the infection. And containment is an important word here. When we started out on this back in March and April, our focus was on containment. And as I'll show you in the slides, we've really moved away from containment now with the spread of the infection and more into what I would call a mitigation phase. So the last comment I'd make on the overall contact tracing effort is that we, at the start, it was just a component of a systematic approach to the infection on the part of the public health departments in our Commonwealth. And by systematic, I mean that it had to work together with masking, testing, social distancing, all the things that have been talked about in this hour for the last number of months. And all of that depended upon our citizens in the Commonwealth, the significant portion of our citizens participating in the process, doing the right things, as the governor mentioned earlier. So if we could put the first slide up, just a couple of comments here overall on where we are at the moment with our program. And while that's coming up, I'll just comment that we have about 1,600 people doing disease investigation and contact tracing today. We started out with about 430 before this all started, so approaching 1,200 new staff have been hired over the course of this program. The other thing that we did is that, and I certainly can't take credit for this, this decision was made before I came on board, but the decision was made to invest in a system that could be used for disease investigation and contact tracing across the Commonwealth. And this was really an important investment, in my opinion, because what that allows is for application in the current situation with COVID-19, but most infectious diseases experts and epidemiologists think that we will have a future pandemic. And so if that does happen, the Commonwealth will be far better prepared to deal with something like that down the road. So that system now is deployed across the Commonwealth. Everyone is using it. There are a few health departments that require some assistance from Frankfurt, but for the most part, everyone's using the system on their own, and it is effective. If we could go to the next slide. This just shows a few things that we're doing with the system. We're constantly improving it. Every 2 weeks, there are enhancements that are deployed in the system that help improve productivity and effectiveness of the tracing and disease investigation efforts. If any information that we have on as we develop it going through this process is available on the kycovid19.ky.gov website. You can, and then lastly, as I would just comment, I get daily reports on the statistics of contacts reached and cases that we've reached that come through each day. We're now over 215,000 daily check-ins with contacts, checking in to make sure that they're staying healthy and doing the things they need to do to protect their families and so on. And that's with about over 47,000 contacts. So the system and the staffing until just the last few months had been effective in terms of playing its role in the public health response to COVID-19. If we could go to the next slide. And I think the governor already stole my thunder on this, but unfortunately, we just haven't contained the spread of the disease, and the exponential growth that we see. I didn't know the numbers today until the governor read them off just a few minutes ago. But you know, we've really reached a point where we're being overwhelmed in terms of our disease investigation and contact tracing efforts. And I think that is in part because we haven't had the level of compliance that we need to have with the public health recommendations around masking and social distancing and so forth. But we can turn that around. We can make a difference with that by taking our individual personal responsibility to heart, knowing that we're protecting our loved ones and friends and family, and we're just being good citizens, and we can turn that around. But the issue that we're facing in the public health arena is that we really are in a mitigation phase now of trying to limit the spread. It hasn't been contained, but we can limit it, and we can do an effective job of doing that over the coming weeks and months until we get a vaccine deployed to our citizens that can get us past the pandemic. So one of the things that we've done, and one thing that folks need to be aware of, is that we've had to prioritize the contacts that we actually reach out and touch on the telephone. And for example, what we've done is if the contact has some underlying health problem, autoimmune deficiency, or some respiratory disease or something that makes them particularly vulnerable to COVID, those are the folks that we're going to call that are contacts. Now, we're going to call every case, and we're going to do a disease investigation on every case, but we are going to prioritize the contacts. So there is a chance, if you were a contact and you were not deemed one of these high-risk exposures, that you will not get a call from the health department. Instead, what we're doing is we're asking our fellow citizens to do a little bit more to help mitigate the spread of the disease. We've developed 2 documents, and they're illustrated on this slide. On the left side is a summary of a document that we're providing to the person who has tested positive. And it essentially summarizes a lot of the telephone call that they receive. And it also asks them to take the document that's on the right side of this slide and provide that to any contacts that they have. So to other family members or friends, folks that they know that they may have come in contact with while they were infectious. And then that person can use that card to sort of self-manage their own quarantine or self-isolation such that they do their part to help prevent the spread. So that all of that information is on the kycovid19.ky.gov website, and I would encourage the folks listening to the show today to review that information. Last slide, please. The last thing that is causing my hair to start to fall out, it turned gray a while ago, but I think I'm starting to lose it now, is we're facing a funding cliff. Essentially, all of our disease investigation and contact tracing effort across the Commonwealth has been funded by the Federal CARES Act. And that funding, we're required to have spent that funding by December 30th. We desperately need either an extension of that date or additional funding or both in order to take this program into 2021 and get us through the months that we need to get through till we reach the point where we have a widely available vaccine. And so that, if there's one Christmas wish that I have for my family, is that we'll get an extension of that CARES funding, and that our representatives in Congress will work diligently to get that done. And so with that, I'll wind it up. I think I would just like to thank the citizens of the Commonwealth that have fully participated in the program. And it is the majority of citizens. And many of them changed their Thanksgiving plans, and they didn't get to have the celebration with their family of thankfulness that we're all used to having, and something that we enjoy in our family. And I'd also like to thank the public health leadership across the Commonwealth. The last time I was on, I called them out. Our physicians and nurses, other clinicians in hospitals and nursing homes and other healthcare provider settings are clearly our heroes, but so are our public health leaders. And so with that, I'll just conclude by saying thank you to them, and thank you, Governor, for having me on today.
All right, thank you to Mark Carter. We are going to move into questions. I've got some written questions, some on the line. I'm going to start with a couple of the written questions. So Chelsea Jones at WKYT, will COVID remain after widespread vaccination? We're still awaiting the answer to that question. So what we know right now is that the two vaccines that are out there help people to either not get sick or to significantly lessen how sick they could be. If Moderna's numbers, for instance, at 100% effective at preventing severe cases hold up, then I heard one national expert say we could turn COVID into something like a cold or a minor flu. But what we don't know yet is whether when you get the vaccine, you can still potentially spread this to someone else. We don't know whether it prevents you from getting it at all or prevents you from getting sick from it. It is a blessing, even if it's just keeping you from getting sick from it. And then the risk of, if you still can spread it, and again, we're waiting to see and the evidence on that. But if a significant number of people get the virus, then they can't get sick from it or significantly sick, even if you can spread it. So that is to be determined, and we are waiting to see. Sierra Henry, how has the governor worked with surrounding states when responding to the COVID-19 pandemic? We work in a number of different ways. I have regular calls with the governors of Ohio and Indiana. We then work with the Midwest governor group. I have a call on that coming up. The NGA, the National Governors Association, also has regular calls. Some of us have personal calls with those that we know a little bit better or where our experiences are similar. What I've found is, for the most part, all our governors want to stop this virus. We may have differences of opinion or differences on willingness on steps that we take, but we all recognize how concerning and how deadly it can be, And we all want people out there to be wearing masks and doing the right thing. So with that, we'll go to the phone lines, and we have Karen Czar from WUKY.
Good afternoon, Governor. Welcome back, Virginia. We're glad to see you. Obviously, the numbers are going in the wrong direction. How challenging is it for you and Dr. Stack and health officials to get a complete buy-in from the public on restrictions, especially from people who are on the fence about it, when other state lawmakers are tweeting or vocalizing support for businesses who won't follow the mandates? And have you spoken directly with any of those legislators to try and get them on board recently?
So getting full buy-in from the public is a challenge, and it's one of the reasons that we are where we are. But I don't want that and it always seems to be the central focus in what we're talking about, because we need more help. And what we don't talk about enough is how the vast majority of people are doing it right, are working really hard, are wearing masks, are doing uncomfortable things, are giving up Thanksgiving, all to protect themselves and those around you. There's a huge amount of sacrifice out there. Unfortunately, we have some that still don't recognize that sacrifice, or who are still playing politics. I mentioned earlier, I'm beyond politics. The decisions I make are between bad and bad, typically. The choices that I have for those decisions are between bad options and bad options. Most of those who state lawmakers who criticize push for inaction. Well, inaction is deadly. Action's unpopular, but I'm willing to do what's unpopular if it saves the lives of those around us. And when you look at those who are criticizing the current orders, well, they criticize the mask mandate too, and they criticize the capacity limitations when we had to do them too. They said the numbers weren't really as big as they were. I've talked before about there being two types of people that believe the world is flat: the ones that outright tell it to you, and some of them are tweeting that, and we know we can never convince them. The others are embarrassed because they believe the world's flat, but they don't want to tell you, and so they keep asking you for data to show them the world is round. And you can even send them the pictures from space. You can give them all the scientific data, and they still ask for more. We are in a worldwide health pandemic. We know the places that it spreads the most. We can either acknowledge the challenge we face and do what it takes all together over these period of weeks, all do our part, not try to be the exception, but try to be a part of Team Kentucky, and we can stop this escalation. Or we can play politics or think that everybody else should follow them, but we shouldn't, and then it just continues to grow. Tom Latek from Kentucky Today.
Good afternoon, Governor. Attorney General Cameron, of course, is appealing to the Supreme Court. And I was wondering, first of all, your thoughts on that appeal, and also his maintaining that this is merely a free exercise of religion with the private religious schools.
Today, we had over 4,000 cases. We are in exponential growth, and we are having, for the deadliest month last month, the deadliest day on the first day of December. And we are treating everybody the same, every school the same. And we're asking all of them and others to do their part to stop this virus. In other words, all we're asking everybody is to make the same sacrifice to stop it. The Attorney General, I think, is the one that wants to create exceptions to that. Exceptions will just spread the virus further. The state already regulates multiple aspects of religious schools. Your cafeteria, has to apply with the different codes and requirements that are out there. In other words, you can't say that's an expression and therefore we don't have to follow those. Your curriculum, you have to teach math. There are already a number of regulations that apply to all schools equally that are out there, and those are legal. Listen, my faith is critically important to me. And right now it tells me that all of us have a duty to love our neighbor and to do our part to stop a worldwide health pandemic. If we are trying to be the exception and think we should be able to do what nobody else does, I don't know that's a true expression of our faith and trying to care about the people around us. And this is going to overwhelm schools that are open. It's as simple as the highest positivity rate, the most number of cases, and exponential growth. Again, if this were a 3% positivity rate, we'd all be in in-person instruction. But when it's overwhelming, long-term care places where we do 3 tests a week of staff, where we have PPE on every day, it's going to overwhelm any school at this point too. We simply can't keep it out. And that means it reaches those teachers, it reaches our custodians, it reaches our bus drivers. We've already lost at least 2 teachers, 2 bus drivers, and a student. And we want to make sure, especially after Thanksgiving holiday, when they think that this thing is going to surge, that we are protecting people at the time when it's critical to slow this thing down. My hope and my expectation is January 4th, we'll be back to some form of in-person learning and it'll look different. But I want to get there too. My kids are missing out too. And it hurts me. And it hurts our family. And we go through what a lot of other families are going on out there. But I'm trying to treat everybody else's kids the same way I would, knowing what we know, seeing what we see, and where our Commonwealth is right now. And listen, we're taking our best punch against this virus. If we only do half measures, only this group of schools or only that and others, then we're not going to get the overall impact that we need to have. Julia Hunter from the Hoptown Chronicle. Welcome.
Hello, good afternoon, Governor. Again, Julia Hunter from the Hoptown Chronicle. And in the first 2 days of the food and beverage relief application portal being open, we've seen there's a really significant need. And I was just wondering if there's any chance of increasing the $40 million that has been set aside. And also if you might be able to speak to if there is a likelihood that restaurants and bars will be able to open at a limited capacity after December 13th.
If there are more than 4,000 applicants or 4,000 eligible locations that exceed the 40 million, then I would anticipate us increasing that fund. The way we set it was based on the criteria and our best approximation, but we want to help every one of those establishments that meets the criteria. That is a reason that we need people to put their applications in sooner rather than later, because again, we have to allocate all the CARES Act money by the end of the year. At this point, we anticipate that on December 14th, our restaurants and bars will be able to open in person, inside, because they can already do in person outside, but could open up indoor dining at some capacity. Now, obviously, we want to watch the numbers, but it's our expectation that we'll be able to do that. And we don't have any other plans at this moment. And it is certainly what we want for all of our communities and for those businesses. I just want to say, I know this is hurting small businesses and different folks, but it's absolutely necessary to slow down this virus. And this is the time when people are the most at risk that they have ever been. This is a time where our hospitals are really filling up. And if we don't take action, and if we reach that critical point in hospitalization where either there aren't enough beds or there aren't enough staff, then the number of people we lose significantly increases. And we're already seeing a significant increase in the fact that when you have this level of community spread, even the best protected long-term care facilities get the infection in and it kills people. So the point is, if we don't take steps to lower the amount of cases right now, a lot more people die than should be. And that's on us to be strong, to be aggressive, and to fight back. Melissa Patrick, Kentucky Health News.
Hi, Governor. I guess I'd like to see if you can talk a little bit about how you made the decision to let elementary schools go back on December 7th, but middle and high school students not till January 4th. And is there any chance that December 7th date will be pushed out?
So the evidence that we're seeing right now is that K through 6 elementary schools are safer. That there appears to be less spread, and that's the reasoning behind that, along with the importance of in-person learning is greater for kids that age and the development that the cycle that they're in. I know it's important for kids that are older, but I think we all can agree that elementary school students being in person, if they can be, is so important. Now, that December 7th date is based on if you are not in a red county. Our hope is that we have tamped down the virus by that point to where there's significant opportunity out there. But right now, we don't see that changing in the executive order. We anticipate December 7th, elementary schools in counties that are orange, yellow, or I pray we'll have a green county again sometime, will be able to do some form of in-person learning again. And even when we look at January, we all ought to expect that it's going to look different with fewer kids in the classroom and virtual options for those who choose it. Joe Ragusa from Spectrum.
Hi, Governor. Is Mark Carter available for questions? I have a question specifically about contact tracing.
I think he is still standing by. If you want to ask your question, they'll go to him while you're doing it.
Yeah. Well, the question that I have, obviously, in regards to contact tracing is, you know as well as anybody that a lot of the arguments against the restrictions as they're put in place, especially with bars and restaurants, is you guys haven't provided enough evidence to justify closing bars and restaurants, at least to indoor dining. What data do you have from your contact tracing efforts to say definitively one way or the other if there are outbreaks happening at restaurants and bars? And I guess if that data is a bit murky, what difficulties do you have in gathering that data as it relates to bars, restaurants, or really any of the other categories of restrictions that we've seen?
I think we both want to comment on this one, and Mark can as well. Let me first say that we're seeing this narrative pushed all over the country. We know how the virus spreads, and the thought that a place where people come together and take off their masks, that it doesn't spread, is us just wishing. The White House Coronavirus Task Force, through their data, through cell phone tracking and the rest that they do, that we don't, tell us each and every week that it's spreading in bars and restaurants. And this thing spreads in Kentucky just like it does in any other state. We have the report from the CDC saying restaurants are specifically more dangerous. We have reports from, I think it's Stanford and Northwestern, that say it's 4 times more dangerous than the next activity that's out there. We have real life examples of the surge in Texas and Arizona and Florida. When they closed bars and restaurants, the cases went down. In other words, it's not just data about where it's spread, it's when you take the step we've taken, do cases decrease? Is it effective? And we have that same data from our July spread as well. We have Dr. Stack and every one of our epidemiologists saying this is one of the most concerning places. We have over 46 clusters related to restaurants in just the Barron River district. So that's data and science and experts and study and real life example and real effectiveness based on what we've seen in other states. But again, if you believe the world is flat and you don't want to tell me that, you're going to keep asking for more data. Okay, go ahead, Mark.
Well, I think that's well said. The only thing I would add is just that the nature of the data, at least historically, on issues like this prior to the implementation of this new system, has been decentralized and housed in the 61 local health departments. So the governor's reference to the Barron River numbers I think is a pretty good indication of what it looks like in bars and restaurants. I will say that we did by around October 1st, we had all but one of our local health departments on our contact tracing system. And Lexington is just stood up and is going through the transition from their current system to the state system. So we are accumulating data. We just don't have much yet that we can share on a statewide basis. But I think as we go on with the system, we will be able to have better data sharing across any location where we see the spread.
All right, Joe Sonka from the Courier-Journal.
Thanks, Governor. Manual high school students recently put out another report showing that there was a Kentucky Department of Criminal Justice training presentation that used a portion of a neo company's anti-Semitic video that comes on the heel of the Kentucky State Police training being 2013 that quoted Hitler multiple times. I'm checking to see is this all part of one investigation into state law enforcement training? And secondly, is there a concern that there's something nefarious that's infiltrated itself into state law enforcement agencies that these trainings would be discovered? And what's your reaction to just the presence of that material in two different training materials from two different agencies?
It's unacceptable, and it absolutely has to be fixed. The people of Kentucky deserve no less, and we have to do it quickly. So right now, we are conducting a review of training and training materials and the potential impact that they may have had on the two areas that fall under the state purview. One is the Kentucky State Police Academy, and the other is the Department of Criminal Justice training. And there have been unacceptable examples in both. We are trying to get through all of the materials, not just currently used, but in the past, identify where retraining needs to be. It certainly shows that we need more training in understanding the communities around us, and we need to do a better job. Whether it is nefarious or whether it is, it's unacceptable. It's unacceptable no matter what. And it's got to be fixed. We deserve, Kentuckians deserve professionalism, and I believe that the vast majority of all of our law enforcement is and wants to be. But we can't have even a single example of this. And we've got to do everything we can to address it. And once we get through the materials, we are going to want help from community members, from the Jewish community, and from other communities right now that are communicating with law enforcement, our Black and African American communities, to make sure that the types of training that we want to put in place are types that create the better type of understanding and communication where we can get better results, better outcomes in each and every interaction. And we only get that with the community help. Michael Brown, who is the top appointed state official, is leading that. But we are not going to be satisfied until there aren't any of these examples, and we know where every past one is and all of the steps that we need to take. Corinne Boyer from WEKU.
Hi, my question is about the comment that Mark just made about Lexington's contact tracing system. Why are they now switching over, and were there any issues with their data because they weren't using that system?
So without using the statewide system, it can't be shared with others. And our goal in bringing in extra help, which we did with CARES Act money, is if need be, a Lexington public health employee may have done the initial call, but that contact tracer can be anywhere else using that system. One statewide system also lets us share information in real time. It gets everybody on the same system for future events. Lexington took a long time coming around to it. I don't think that there were great reasons for it, other than change is hard. But I do appreciate that they did come around to it. But I do believe that the Lexington Public Health Department is working really hard. I think they're working really hard, and they're trying to provide good information to the people out there. We're providing them some extra help in entering data into our system, so it gets into our system in time. And I think leadership from Mayor Gorton and others in Lexington has been exemplary in trying to do the right thing. We talk, I think, every other week to make sure that we are on the same page. And I'm hearing from her constituents, and we're communicating about steps that need to be taken. I think Lexington and UK are all working really, really hard and doing the best job they can right now in this pandemic. And let me just say to all our local health departments, to everybody out there working in one, thank you. I know you would have never thought that just by doing your job, you'd be harassed and you'd be threatened while you're trying to save people's lives. My faith teaches me that doing the right thing is supposed to be hard. And maybe none of us knew that it would ever be quite this hard. We're going to do the right thing. And when this thing is over, we're going to be able to sleep at night knowing that even when people sometimes didn't want our help, we provided it anyways. All right, Shelby Smithson from WKYT.
Hi, Governor. We are hearing from several child care facilities that are struggling or having to close down completely. So especially right now when the need is so high with schools virtually, will there be any financial support opportunities for child care like there are for other industries?
So we exempted child care from this executive order. We think we've got the right balance in place in child care right now. We are seeing COVID outbreaks, but we think the balance is generally right there. We do have a new program that helps new child care facilities start to open, but we can relook at where many of our facilities are right now. You know, a new round of CARES Act money would be incredibly helpful, not only there, but everywhere else. And I just want to end by highlighting what happens if Congress doesn't act. If Congress doesn't act, we don't have any additional relief for restaurants and bars, and they need it, and I am for it, and I will push Congress. I will be public about it each and every day. I know what we can do for you doesn't make you whole. I know that you're hurting, and I hope that they can provide the dollars to truly help everybody get through this. Without another round of CARES Act funding, we don't have individuals who are on unemployment getting that extra amount that it takes to get by. Without more action from Congress, many people are going to lose their unemployment, and it's going to go to nothing because of the limitations they've placed and their failure to extend it in a time that it must be extended. Without another act of Congress, our localities, our cities and counties are going to continue fighting COVID with no funding to do so. Without another round of funding, there won't be any additional eviction relief help. But, you know, we ought to look forward, hopefully, to our next budget and see what we can do there. But without, you know, another round of CARES Act funding, we don't have any dollars for testing, for tracing, for all of the things that you've got to do to stop this virus or to continue to give extra support to our local health departments. Now, when we put together the budget that we're going to put together, we're going to do our very best, but you know that budget takes effect July 1. So certainly January, February, March, we need help from this federal government, and just give us the same help that you were when the virus was previously at lower levels than it is right now. So it is absolutely critical. And it seems that both parties in DC believe that it's critical, but just have gotten to a point where they can't seem to even agree to help people together. So let's hope that we have changes of heart there and that people start being human beings before Democrats and Republicans and get this thing done. Today's hard. I knew when we went from 2,000 cases to 3,000 cases so quickly that 4,000 was just around the bend. But in a state of 4.4 million people, to go as quickly as we have from really 1,000 cases to 4,000 cases is really concerning. And it puts every individual out there at risk. So please wear your mask. And today I'm going to ask you to do it to protect yourself. We have enough exponential spread out there, and we have enough people that aren't following the guidance where you need to protect yourself and your family every day. Do it for those around you, but do it for yourself too. And I think these numbers just show why we have to be aggressive. If we're not aggressive, is it 6,000 in the next 2 weeks? By the end of the month, is it 10,000 people a day in Kentucky? Lord, I hope not. But exponential growth catches up to us really fast. And they're estimating that 30+%, maybe even 50+% of people in the Dakotas may have gotten infected. And we never want that to happen here. In March and April, we successfully prevented Kentucky from becoming what New York and Louisiana did, where they experienced significant death. In July, we prevented Kentucky from becoming what Florida and Texas and Arizona were, where they experienced significant death. Right now, it's our job to make sure that Kentucky doesn't become what the Dakotas and Wisconsin and many other places. I know a day last week, Indiana reported over 100 deaths in a day. But folks, that can be us if we don't take action and we are unwilling to support significant action. Yeah, this thing's hard. It's been a long time since we've been fighting it, but it's not done with us, so we can't be done with it. So everybody, take a breath, hug your kids, hug your family, get a good night's sleep, and get up tomorrow ready to take this battle to COVID. It's as easy as putting on that mask, staying 6 feet apart, asking everybody else nicely to do your part. We can defeat this thing if we're just kind and care about each other, so let's get out there and do it. Have a good night. I'll see you at 4 tomorrow.